How are ya? Yeah, I don't know what I'm doing. Yeah. Yeah, thank you for having me. Mhm. Awesome. Sorry, I'm just adjusting this so I don't have to hold it. Is that okay? All right, cool. Mhm. Yeah, excited. Thanks for having me. Mhm. Yeah, that's interesting. I would say 90% of my patients come in with anxiety, whether that's sort of their main complaint or something that's a little bit more secondary. And it's really not uncommon to see the anxiety be provoking digestive distress in some way, shape, or form. So the two are very much connected. As far as specific conditions are concerned, I treat a lot of IBS, definitely some autoimmune digestive disorders. So I've treated Crohn's, ulcerative colitis, celiac, um, a lot. Yeah. Oh, sorry. Yes. Yes. The IBS tends to have a fairly significant stress component to it, for sure. And then I would say probably in the past couple months, I've been seeing an influx of patients with constipation. So, and that's kind of always been there, but it just seems to have been on the rise, especially with female patients. I don't really see it so much with males. Mhm. Yeah, I definitely think that plays a role. And I don't know the specifics of it, but I have done some research that seems to indicate that females have a little bit of a longer colon, and that and just because of the physiology of the whole pelvic cavity, things are kind of jammed in there. The space is a little bit tighter to begin with. So to have that much more intestinal kind of tubing to go through in order to eliminate can just make things that much more complicated. The hormones definitely come into play because I see digestion going off the rails one way or the other, where it's potentially constipation, potentially more on the loose side right around the cycle. Um, and I do think there's probably something to be said for the fact that women are probably a little bit more comfortable talking to me about that sort of thing, and men probably not so much. But it does seem to be the case that men have sort of smoother sailing on that front. Yeah, yeah, normal, normal. Right, right, exactly. Normal is a very relative term. Hmm. Hmm. Not necessarily, and that sort of speaks to the style that I practice. So there are acupuncturists, or are styles of acupuncture out there where you can be treating based on the symptoms. Um, More often than not, you are taking into account the body's feedback, and the style that I practice is very heavily reliant on the body's feedback. So I'll take patient's pulse, and I'm looking for so much more than just the heart rate. I'm trying to tap into different qualitative factors. The pulse positions correspond to the different channels, so I can get information based on that. And then I do a lot of abdominal palpation. And when I palpate and find areas that are tight or feel tender or sore to the patient, the sort of composite picture of that informs my treatment. So that is sort of an indication of the root imbalance that's going on. So the body's really asking for something, and I'll layer in the patient's, verbal report of what's going on, and that certainly comes into play. But I'm going off my initial round of treatment based on what the body's saying largely. And then I want to see that things kind of settle down after the needles have been in for a few minutes. And depending on how the patient responds, I'll probably be layering some treatment on to focus on the very symptomatic complaints and how they're showing up. So that's where things might get a little bit different if it's just, an autoimmune condition versus something that's very much anxiety mediated. Mhm. Yeah, yeah, exactly. Yeah, I mean, the body always has something to say. It's just a matter of asking it and knowing how to listen and what to listen for. And it's always shape shifting too. So, so I'll try to give you the Cliff Notes version because I certainly have a long version as well. I got interested in acupuncture when I was doing yoga teacher training years ago. I got really into yoga for stress relief and started feeling the mental emotional benefits, so much so that I decided to do yoga teacher training, and we had a module on Eastern medicine and acupuncture. I thought it was super fascinating. It just wasn't really the right time in my life. So fast forward several more years of I was working in advertising, and I was kind of burning myself out and teaching yoga on the side, and I had just gotten myself into a pretty stressful situation with a new agency job, and so I started going to an acupuncturist on my mom's recommendation. It was her acupuncturist. And I'd always known that I'd want to be somewhere in the health and wellness realm. I knew advertising wasn't for me, but I just hadn't, had that spark yet. So I went to an acupuncturist, and in 3 visits, I was strictly looking for stress relief and insomnia. I don't sleep if I'm stressed. So that's all I really wanted to address. But this is a little TMI, but acupuncture or Chinese medicine is all about bodily functions, and there's really no such thing as TMI. So, and in 3 visits, it brought back my period, which had been missing for 3 years, which is a little shameful that I wasn't even looking to address that. But it was just such a palpable experience, and there were no other variables in place. So it was strictly the acupuncture was the only different thing. So I knew it wasn't diet, it wasn't activity, it wasn't stress. Well, I mean, the acupuncture was addressing the stress, but it brought back something that had been a very vital bodily process that had been MIA for 3 years. So to me, that was this sort of can't ignore it. This is the push that I need. So I pretty much dropped everything and went to acupuncture school. Yeah, yeah, it's cool. Yeah, right. Exactly. Exactly. Mhm, mhm. Yeah, I can probably show you a needle if you want. I don't really show up. Yeah. Yeah, it might actually be hard to see, but so they're all, where am I here? Woo! They're all in their own little guide tubes, so it makes the insertion really smooth and painless. And then this is the needle itself. I don't know if you can see it wiggling. It's super thin and tiny. So, but yeah. And that's not to say that everyone uses those needles. There certainly are styles that are a little bit more aggressive, and there's, a reason for them. Orthopedic style acupuncture certainly does good things for musculoskeletal problems, but the style I practice is much more focused on kind of a minimalist approach. Um, so, as far as mechanisms go, acupuncture is a really strong communication to the nervous system. So there's a few different ways that that happens. You get an immediate response when you put a needle in the body. The body registers that as a tiny little injury and mounts a healing response. So with that, you get the immune system kind of coming to the rescue, and you get a nice improvement in circulation, accumulation of endorphins, which are going to make you feel good, some pain relieving molecules and substances. Um, Acupuncture and certain points have different effects. Some points more so than others are really, really capable and powerful at activating the vagus nerve. And the vagus nerve is really great for kind of flipping the switch on your autonomic nervous system. So your autonomic nervous system, and stop me if I'm being, redundant or yeah, so there's two branches. There's your sympathetic nervous system, which is fight or flight, and then your parasympathetic, which is rest and digest. So we're designed to be in rest and digest state 99% of the time. And fight or flight serves its purpose to get you out of immediate danger, but we tend to be sort of chronically in the sympathetic overdrive. So acupuncture is really good for flipping the switch on that. And especially for patients whose GI issues are mediated by stress, anxiety, that sort of slipping into the parasympathetic mode does wonders because it has a ripple effect. So whatever it's activating or overactivating, digestive system we're talking about here, putting your body into that relaxed mode just sort of calms everything down. And you can be treating points specifically for specific issues, but sort of generally speaking, that's one of the major effects. Mhm. Right. Hmm. Yeah. Mhm. Sure. Mm. Yeah. Hmm. Hmm. Yeah. 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 No, I get that. And I hear that too. So acupuncture is generally not a one and done type of treatment. It's a signal to the body. So it's a nudge to the body to do the work on its own of resolving an issue. And so, depending on what's going on internally, that signal might get buried and it might not really register right away. So, and often it doesn't because there's sort of a lot of inputs going on all at once, especially if there's some sort of chronic issue bubbling under the surface. So, usually it takes a few treatments to really be feeling tangible benefits. Often people feel pretty relaxed straight out the gate. As far as pain relief, that's pretty individual, but the effects build. So it is a cumulative sort of situation where your body will register the signal the more that it receives it. So usually my recommendation is to come once a week for about 4 weeks or so, because that gives your body somewhat of a loading dose. So some medications you have to take a loading dose before you can kind of get into maintenance mode. And it's like that with acupuncture too. And often once you've had 3 or 4 visits, body kind of registers and understands what's going on, what's being asked by the needles, more or less. And often people can space treatments out from there. And it's individual too. It really depends on how long something's been an issue. I mean, if it's like a 20-year history of Crohn's that has, not been given the attention that it deserves, it's going to be a longer treatment course. Whereas if it's someone who's experiencing IBS and it's a fairly new situation, it's probably not going to be quite as long. Mhm. Yes, yes. Initially, yes. And also, if you think about it in terms of the different stimuli that you're exposed to, acupuncture is usually one stimulus a week. Most people come once a week at the beginning. But if it's a digestive situation, a digestive disorder, most people are eating multiple times a day. So that's a stimulus you're getting on a very frequent basis. And whether that's something that's helping or harming your situation, you're getting more exposure to that. So it can certainly take a few visits for acupuncture to kind of make it an impact given all the other things that are going on. And that's why it's a whole body medicine. And I'm very often giving patients lifestyle recommendations, things that you can do at home, things you can do in your car, breathing techniques, all sorts of things that are designed to actually just put your body in that parasympathetic mode, because that's when the magic happens. That's when the healing happens. Yeah. Yeah. So one of my favorite breathing exercises is called 478 breathing, and I wish I could take credit for it, but it's actually Dr. Andrew Weil. He's sort of a natural medicine behemoth. He's written a ton of books. He's super interesting, and it's really simple. So essentially, it's an inhale to the count of 4, hold for the count of 7, and then an exhale for the count of 8. And so you can do this however many times works for you. I usually recommend doing at least 4 rounds, and you'll find the more you do it, the more you kind of stretch out the time it takes to count to 4, to 7, to 8. Um, but having the emphasis more on the exhale than the inhale is where your body's going to respond and flip the switch on the nervous system and go into the parasympathetic mode. So it's longer exhale. So at least 4 rounds. For my patients, I have a patient right now who he has digestive issues, and I recommended that he does that at least 4 rounds before every meal. And I also treat his wife, and she told me that her kids are like, "Why is Daddy breathing so heavy?" Because he really gets into it. But yeah, it definitely helps. And these are all things that are just tools in your toolkit. And I think it's really nice to have some agency over the process of your own healing and feel like you can make an impact. And it might not be a night and day difference right away, but it feels good to take your health in your hands. Mm-hmm. Yeah. Fun. Yeah. Mhm. Exactly. Yeah. And all these modalities work better together. There's a sort of synergistic effect. Mhm. Oh, inhale for 4, hold for 7, exhale for 8. Right. It's because it's the exhale that puts you into the parasympathetic mode. So it's the long, intentional exhale. Yeah. I mean, you think about it. If you're stressed out, if you're kind of heightened emotions, it's like short, shallow breaths. It's not hard to get them in, but it's hard to fully exhale. Yeah. Mhm. Yeah. Yeah. Oh gosh. I know. Well, I mean, I'm certainly biased. I think it's wonderful, but it helps a lot with anything that has a stress component, an anxiety component. Acupuncture is really, I mean, I see great results with my digestive patients. I would say the extent to which I see results is dependent on how willing patients are to be involved in the process too. So the ones who kind of take on the challenge and they're willing to make some changes, and I never ask anything outrageous of anyone. I want it to be simple, accessible, but just things like breathing exercises or taking time for yourself. I mean, self care, I'm kind of always waving the self care flag because there's not enough of that. And so this is a little Chinese medicine tidbit. So I'm going on a little bit of a tangent here, but I know we've talked a little bit about the spleen in Chinese medicine and the stomach. So we have the 5 elements in Chinese medicine, and the earth element is made up of the spleen and the stomach. They're organs, channels, and the spleen in particular has the earth element. If you think about earth, like you grow your produce, you grow things from the earth. So the earth element is all about nurturing and nourishment. And a lot of times we don't do enough of that for ourselves. We're nurturing and nourishing everyone and everything in our lives to the exclusion of our own self-care. So it's no surprise to me that when I see people, and a lot of times it's women, but it's everyone, who are a little shortchanged on the self care department, they tend to have a lot of spleen and stomach imbalances. And in a Western sense, that's showing up as a digestive issue, whether it's irritable bowel syndrome or just constipation or something like an autoimmune digestive disorder. So self care is not to be understated, underrated. Yeah. Mhm. Yeah. I was just going to say that. Yeah. 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 Mhm. Yeah. Exactly. Yeah, that's just the culture we live in. Seize the day. It's sleep when you're dead. And that's sort of gotten us in the position that we collectively are, which is pretty stressed out, dealing with a lot of different things digestively and otherwise. So, yeah, saying no is huge. Self care comes in many shapes and forms. Oh, thank you, Erin. Yeah. Thank you. I'm grateful to know you, Erin. Such a delight. Yeah. Mhm. 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 Yeah. So my website is sort of abominable, but it's meghanmeadacu.com and it's MEGHANMEADE and then ACU.com. I'm also on the Wellness in Motion website. So I believe the website's wellnessinmotionboston.com. So you can find me there. My Instagram, which is kind of collecting cobwebs right now, but my Instagram is another way to find me. It's Meg's on the Move. Ah, job. Yeah. Mhm. Yeah, so I'm at Wellness in Motion in Brookline, Tuesdays, Fridays, every other Saturday. And then I work at a pediatric neuropsychology practice on Mondays and Thursdays. It's called NESCA. That's where I am right now. This is my treatment room. But I actually see a lot of adults here. So it's not strictly relegated to kids by any means. Thank you for having me. Yeah, same girl, same. You too, Erin.